Hello, it's Dr. Daigle here with Mom and Me MD, here for another Hot Topics Tuesday. This week is GERD Awareness Week. So I know many of us, especially as adults, have experienced at some point some heartburn, some indigestion, categorized as GERD, gastroesophageal reflux disease. But since this is platform is for moms and babies, I thought let's talk about this dreadful spit up called Reflux in Babies, because I have two kids and I dealt with them with spitting up of their breast milk and formula. And I know it brings a lot of parents aggravation and frustration and worry. So today we're going to talk about reflux in babies. So like I said, the dreadful spit up. So all babies will spit up at sometimes. It's actually fairly common and fairly normal, especially as they are growing and the volume of breast milk and formula is increasing, and their little bodies are trying to adjust to keeping food down. But for parents, it seems like everything your baby eats comes right back up, right? It's like soon as you birth them, here it all comes pouring right out. I see it time and time again. It's one of the many chief complaints for babies who are brought into the clinic or even the ER, depending on the situation around the spit up, especially if it ends up being a very scary event. And it can be very scary for some families, especially when the milk comes out of the mouth and the nose. But how do you know if your baby spit up is the normal spit up or part of a larger problem? So let's talk about it. So what is reflux? So the esophagus is a tube that runs from your mouth down to your stomach, and it's what carries your food through muscular contraction down to your stomach for digestion. So if your baby is experiencing reflux, this means that the contents, once they hit the stomach, they come back up into the esophagus, and this can cause some discomfort. And again, it can even go as far as to come way out of the mouth and the nose too. I've had that happen in my children, and it can be very alarming and very scary, especially if it's happening in the middle of the night when you lay them down to sleep and you hear them making noises, grunting or coughing, or it's just spitting up. So reflux has two other names: gastroesophageal reflux, GERD, or gastroesophageal reflux disease, GERD. Why does it happen in babies? So if you look here, this is the esophagus and this is the stomach. Right here is typically a valve or a muscle called a lower esophageal sphincter. And this prevents the stomach contents from coming back up. Because if you can imagine, food is supposed to be moving down for digestion, not going backwards. So in babies, this muscle is not often developed. And so reflux can more easily occur. So again, it's part of that being young in a lot of the babies. So though aggravating, reflux can be normal. Some babies are not cranky even when they're spitting up. So a lot of times when I would see a baby in the clinic, I'll ask the families a little bit around the scenario of the spit up. Sometimes the babies, after they burp, a little bit comes out. And I ask the families to just quantify it to see, is it really everything that the baby's just eaten, or a little bit 5 cc's of the 30 mLs that they have eaten, which is not that much. We call these baby happy spitters. GERD usually starts around 2 weeks of life and resolves by 9 to 12 months on average. As I was saying, some babies are not cranky and don't appear to be in pain. We call these babies happy spitters. GERD usually starts around 2 weeks of life and resolves by 9 to 12 months on average. So it can go pretty much almost the first year, but it should start to get better as your baby starts to have more head control and starting to sit upright more on their own, which happens on average around 6 to 8 months. And then they're also going to start taking in more solids, which helps to keep some of the food down. Of note, preterm infants often deal with reflux too, because of the immaturity of the GI system. So if you can imagine, if a term infant deals with it because that esophageal sphincter, that muscle, doesn't really fully constrict around the end of the esophagus to keep the contents from coming back up in the stomach, then imagine for how much more for a preterm infant. So what are some symptoms that you may see in your baby? So basically, some forceful spitting up sometimes. Sometimes it's not always forceful. Sometimes it's soon after you burp, 15, 20 minutes later, milk is coming up out of their mouth and maybe even their nose. Okay. You can see some coughing or hiccuping when feeding, or you maybe hear some wheezing, even some congestion. I've had some families say, my baby seems to be a little bit more congested after they eat. Sometimes that could be refluxing back up into their nose. Sometimes the babies are unsettled or cranky, so they just look like they're uncomfortable while they're eating. And sometimes you might see a baby gulping or swallowing after burping or feeding. A lot of times that means that it's a sign that they're about to spit up. They're dealing with a little bit of reflux. I often encourage my families, if you see that, go ahead, pick up your baby and start patting them on the back and see if they need to burp again or help them settle down what they were trying to bring back up. If you're dealing with more of the GERD, which is when we add the D on the end, the disease, we're really saying that it's more than just a happy spitter. These babies are having extreme symptoms, such as not gaining enough weight or arching, called Sandifer syndrome, because of the thought is the acid causing discomfort, the pain, and so the babies arch, like their back like that, like, oh, it hurts. Just like if you've had reflux and you want to kind of grab your stomach because you're experiencing that pain right there, right below the middle of the rib cage there. The babies can feel a little bit of that same sensation. They just don't have the words to say that. How do you diagnose it though? So if you're concerned about your baby spitting up, the degree they're spitting up, then you will want to see your pediatrician and review the symptoms, and they'll go over the feeding pattern. So a lot of times I like to see the babies and ask, okay, describe a feeding to me. What have you fed them? How much have you fed them? And then how often are you burping them? And then what do you do after? And then how long does it take for them to spit up and how much? So very detailed questions to get an idea of, one, if it's a serious degree of spitting up, and then some strategies that the families can implement. So your pediatrician will do that, or should ask those questions, but then also look at your child's growth pattern. So if your baby's still gaining weight and growing along well, then the degree of spit up is not necessarily affecting their growth. Then they're keeping what they need. Also, this helps us decide if they're a happy spitter or if they're more rooted in more of the GERD, the disease, not just simple reflux pattern. And then that's when we may be thinking about adding other things on, especially if the common treatment mechanisms are not working. So as frustrating as it is, changing the clothes, changing the spit up, changing the bedding multiple times a day, there really is no quick fix for babies who spit up. Again, these happy spitters, it's just a matter of time before it gets better. They're growing, their muscles getting tighter. At the end of the esophagus, they're eating a little bit better. Overall, growing makes things better. Time makes things better, as frustrating as it is. But here are some other strategies, like feeding position changes for more frequent burping, sitting baby upright for 30 minutes after feeds, things like that. And sometimes you may have to even change the formula. So sometimes the spitting up may be a sign of just intolerance. If you talk with a GI doctor, they'll say a baby should not really be lactose intolerant, even as a lot of families bring up their family history of that. But I don't think it hurts to have to change a formula to see if it'll make a difference. And there's some different ones out there that have a little bit of added rice because, traditionally when we would have spit up, we used to say add rice into the bottle, which is not traditionally recommended anymore because the nipples are often not made enough to get that out. And then it really just depends on how thick. And you'll see a lot of different conversation about that between doctors about adding that, some of more of the old school versus the new school way of doing things. But that's since they've incorporated into certain formulas, and I'm not being paid by any brands, but something like an Infamil AR is what we've added, and Similac, I believe, has a similar brand, a similar type of formula, excuse me. And then, but if you're breastfeeding and the baby's doing it, then more of the position changes, or things like that typically tend to help a little bit more frequent burping if necessary. Of note, didn't really see my baby dealing with too much of the reflux unless I had an overactive letdown. So a lot of times it was dealing with a hyperactive lactation. So if you have overactive letdown, sometimes that can cause your babies to have some more reflux too, because they're gulping in a lot of milk and not really having the time to let it transit. If reflux is severe, however, treatment may include some medication, to include an antacid or even H2 blockers. So in the family of like Zantac is not recommended anymore. So basically going with things like Pepsids or some of the other brands to help decrease the amount of acid that's being made. Again, the spitting up may still happen a little bit, but it may not be as aggravating to the baby. In some extreme cases, the baby may require surgery. And then that's when you typically are seeing a GI doctor to make that decision. So if your baby's not gaining weight or experiencing more of the extreme symptoms, like I mentioned, like they're coughing, like signs of aspiration, like they're coughing because they're spitting up so much, is going back into the lungs. They're starting to wheeze, or if there's like they're concerned for other anatomical issues, like sometimes it's not just the esophageal sphincter, but there could be some other obstructive concerns further down, that will make you to say, maybe we need to have this baby evaluated a little bit further. And so your pediatrician will often refer you to a GI doctor, who will then still ask some of the same questions. So they're still going to tease out the feeding history, the history of spitting up. All these details matter. So here's some tips for my family. So feeding your baby in an upright position certainly helps. Sideline is good too, especially with breastfeeding babies. I've fed babies like that in the NICU, and I've seen them do a little bit better. Holding your baby upright in a sitting position for 30 minutes after feeding too, just allowing things to settle a little bit more. Taking time to burp your baby often. And so one of the other things that comes up too is overfeeding. So sometimes our families, when the babies are crying a lot, they tend to get overfed because the families think that they're always hungry. And so that's one thing to pay attention to. If you fed your baby a pretty decent amount and they really were content, and then they seem to get, because sometimes the crying could be because they've been overfed. They've been fed so much, now they have discomfort from having too much on the belly, and then you end up entering a cycle of they're crying because they're really discomforted from being overfed, and now you're feeding them more thinking they need more, and then it's just getting worse. So in that instance, you can try smaller, more frequent feedings. So instead of 3 to 4 ounces at one time, they might eat 2 ounces, and then 2 hours later eat another 2 ounces or something like that, especially formula. Breastfed babies obviously got their own journey. And so then just seeing, making sure latches is good, and stool is good, and that your let down is not too much. And typically these things tend to fix these problems. Putting your baby to sleep on her back. So I know this gives a lot of frustration for families because they feel like they worry more that, oh, if my baby's laying on his or her back, she's going to choke if she spits up. But actually anatomically is a little bit different, and it's more protective because of the way the anatomy is with these regard to the epiglottis that protects the trachea when a baby is swallowing or spitting up, that overlies that area. And always talk to your doctor if you're concerned. So, this is something, like I said, it's frustrating for families, and I've gone through it. I've been scared. I've been worried seeing milk coming out of my baby's nose, and just wondering, oh my God, like, are they going to choke? And color changes. Sometimes it could be so bad they turn red and purple. And so these things are not to be ignored. Definitely paying attention to the volumes you're feeding, how often you're feeding, how often you're burping, positioning, all of those details matter. So when you go to talk to your pediatrician or healthcare provider, make sure to have those details outlined so they can help you tease out the next step. So thank you so much for attending this talk. I apologize if you hear a lot of background. It is the holiday weekend or week, and I am at home with my children too. So you know how it is, trying to hide while you try to get these things done. But I am open for in-home care bookings, either virtually or in the home, especially if you're in the Atlanta area. like 30-mile radius from the city center. Again, this is medical education only, so talk to your healthcare provider if you are concerned about your baby. I hope you have a wonderful Thanksgiving week, and we will see you on the next Hot Topics Tuesday.